Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Renal stones investigations. So first is the urine routine and the microscopy. So this includes to evaluate the color as well as the pH and the specific gravity, and check the presence of the sugar as well as the albumin. Then will be to count the RBCs and the WBC as well as the presence of the pus cells, and examine the cast and the crystals. Now let's look at the urine culture. The urine culture, it is used to confirm the infection and also diagnosing the UTI, the causative organisms and the deformative that determine the antibiotic sensitivity. Now what about the X-ray KUP? So here it sends the 90% of the renal stones, 90% of the renal stones, and they are radiopaque, and X-rays can be used to detect them. So detect by the X-rays. So ultrasound is a screening investigation for the hydronephrosis. So hydronephrosis is where you use the US ultrasound. Then IVP, you have IVU. So all these, that's the intravenous pyelogram and the urogram, they assess the site of disruption, site of the obstruction, and assess the proximal part of the obstruction. Next is they evaluate the hydronephrosis and examine the renal function. So RGB is nothing but retrograde pyelogram. It is assess the distal part of the obstruction. Next is looking at the radionuclide scan. So radionuclide scan, it includes the DMSA. DMSA is dimercurochromyl succinic acid scan. This is to assess the morphology and the scar and the surface anatomy. So this is the radionuclide scan, the DMSA, to assess the morphology, scar and the surface anatomy. Then you also have the DTPA, that is the diethylene triamine and the penta-acetic acid scan. So diethylene triamine penta-acetic acid scan. So this is to evaluate the perfusion and the function used in the renal perfusion and the function. Next is the NCCT. The NCCT is the gold standard for diagnosing the and this is for diagnosing the urinary stones. To learn and grow daily like this, please do subscribe.